Hi everyone, I'm Dr. Bhavna Nair. I'm a dentist, to be precise a prosthodontist by profession. Today we'll be talking in this video about various removable treatment options that is available at your dentist, with the help of which you can replace the lost teeth in your oral cavity. Now, you can either lose a complete set of teeth or you can lose few teeth. So based on these two scenarios, we can have complete denture and we can have partial denture. Partial denture as in a denture that is going to replace only the number of teeth that has been lost. It is going to take a grip of the adjacent teeth. So with the help of which it is going to be retained in your mouth. Now these partial dentures that is there will be available in three types. So the first type of partial denture that is available is cast partial denture. So this kind of a denture will have a metallic base onto which we are going to replace the teeth, and this will take a very firm grip onto your adjacent teeth. आपके जो आजू बाजू के दांत है उनमें से वो grip ले लेंगे, and when you replace the denture into your mouth, it is going to be held firmly against the remaining teeth that is there. This gives you very good comfort and chewing efficiency. Second type of denture will be interim partial denture. With the name itself, we know it will be used for a temporary period. It is not as strong as cast partial denture. A cast partial denture will last you for many years. In case of interim partial denture, it probably will last you only for few years. This is the pink colored material that you always see. You might have seen many people around you using this kind of a denture. Pink colored material over which the white colored teeth are present. It has a wire coming out of it. That essentially is an interim partial denture. It's a very common treatment that people undergo these days. So with the help of the wire that is coming out, you can clip your denture onto your remaining teeth and you can start using it very comfortably. Third will be flexible denture. With the name itself, we know that it is something that is going to flex like an elastic. So you can just flex it, as in you can just fold it, place it in your mouth and just lose it. It's going to take a very tight grip onto your tooth, and with this kind of a denture, if you are the right candidate for flexible denture, the satisfaction that is going to come to you is going to be immense when you go ahead with treatment plan that is there with a flexible denture. Now this is about partial dentures. Second will be about complete denture. If you are a patient who is devoid of all the teeth, if you don't have even one single teeth present in your oral cavity, then you can go ahead with complete dentures. Complete dentures is something that many of us would be very familiar with. It is that set of false teeth that we all have grown up seeing our grandparents taking out of their mouth and placing it in water at the end of the day. If you have a memory of that, you already know what a complete denture is. So since we are familiar with this term, we need to know how a complete denture is fabricated, how many appointments are required, and also the maintenance strategy of the same. So for the fabrication of a complete denture, essentially you're going to need to make 5 appointments with your dentist. By the end of the 5th appointment, your dentist is going to deliver the complete denture to you and you'll be good to go. You can start using it. But there's an adjustment period that will be required when you're using complete dentures for the first time. So maybe after the 5th appointment, if you want another few appointments so that you can go back to your dentist and voice out your emotions about the dentures, about the difficulties, you can definitely do that. Another 1 or 2 appointments would be good. And the adjustments according to your requirements would be done, your comfort would be re-established, and you can start using complete dentures very comfortably. Now, even after a thorough adjustment period, if you have failed to establish comfort with complete dentures, as I have said that, what will raise in your mind is why suddenly I can't develop complete comfort with complete denture. Then why in the first place should I go ahead with that treatment? What we need to understand here is comfort is subjective. It varies patient to patient. There are many patients who use complete dentures for extended period of time, for a period of 20-30 years, and they still come back saying they want complete dentures only. If we give 10 other treatment options that could be better for them than complete dentures, they would still go ahead with fabricating complete dentures only because they have established that kind of comfort with the dentures. They are very comfortable eating and speaking with dentures in their mouth. But there will be people with enhanced treatment requirements. Like if you are someone, if you are a public speaker, if you are a teacher, if you want that kind of grip out of your complete dentures, then this is the comfort that I was talking about. If you are someone who has failed to establish that kind of comfort with your denture, if your requirements out of a complete denture is more than what the requirements of a normal person would be. In that kind of a scenario, you can always go ahead with implant supported overdentures, which means you place few implants in your mouth and you can just clip your complete denture onto it. It will give you not just amazing amount of retention, it will also facilitate in enhancing your confidence when you're using complete dentures. Coming to the maintenance aspect of complete dentures and partial dentures, it's a very simple procedure. All you have to do is after every meal, make sure you're cleaning the denture as well as your mouth. By the end of the day, place it in a bowl of water, not hot or cold water, place it in normal tap water. Always keep your dentures immersed in water because it is supposed to be in a wet field. If it's not kept in a wet field, if you're keeping it in open air, what will happen is your dentures are going to shrink, and we don't want that, because once it is shrunken, it is not going to fit into your mouth as it did once upon a time. Always keep it in water. In the morning, you can clean your denture with the help of a soft toothbrush and liquid soap diluted with water. Please do not clean your dentures with toothpaste, because toothpaste is meant for cleaning your teeth, not your denture. The material that your tooth is made up of and the dentures are made up of are two different materials. Always go ahead with liquid soap diluted in water and a soft toothbrush to clean your dentures. So make sure you maintain these simple procedures judiciously so that the dentures can function for you for a longer period of time. I hope this video was beneficial for you. I hope you have gotten certain idea about complete and partial dentures. If there's anything that you fail to understand, please get back to me in the comment section. I'll be more than happy to solve your queries for you. Thank you.